Thank you all for joining us. Before we reconvene, I would ask all who would care to join Mr. Coe in the Pledge of Allegiance and a prayer.
Lord Jesus, help us in all our decisions that we make, because it is a critical time for the decisions we make. Please guide us, help us with our students, our faculty, our administrators, do the right thing in the coming months. In Jesus' name we pray. Amen.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. At this time, I'll entertain a motion to reconvene and to approve the agenda. Motion from Mr. Coe. To have a second? Second from Mr. Badgett. All in favor? Any opposed? We are back in session, Dr. Reeves.
Thank you, Dr. Mosley. I'll join you at the podium. Good evening again. It's my pleasure. I want to thank, first of all, Copeland Elementary School for hosting us. Margaret Spicer, our principal. I appreciate them allowing us to come here. We've tied up their cafeteria for a couple of days now. I also want to say thank you to Kim Freeman, my administrative assistant, who's here tonight, and is also, as you know, meeting in our schools is we have more space, just can't do this meeting in our Board of Education room. I want to thank David Brown. Make sure you appreciate it. I want you guys to know how much we appreciate you putting together this video for us so that people can join us remotely. Tonight, it's my pleasure to recognize our February 2021 Leader of the Month. And I've said this many times to our principals, but February is the month of love, right? And we love our school nurses in Surry County Schools. And I want you to help me congratulate our 2021 February Leader of the Month, Jan Castevens, nurse at Franklin Elementary School. Jan? Jan is here tonight with her husband. I want to say thank you for coming here tonight. And you probably have a lot of fans out here watching. Miss Castevens received over 30 nominations this month for Leader of the Month. And I just want to tell you how proud we are of her. We surprised her at Franklin and saw a few tears. And we know how hard she works at Franklin Elementary School. And we also know how hard she has worked during this pandemic to keep our students safe and our schools safe. And I'd like to take a few moments and just read a couple of these nominations. Jan has always been an excellent nurse, but this year she has gone above and beyond. She is always kind and caring to everyone around her. She has been extremely patient and understanding about all the situations she's had to deal with. I don't know what we would do without her. Miss Castevens is a positive influence in our school and community and is an extremely hard worker. She is always upbeat and positive and has accepted the many changes and challenges that COVID has brought to our school. There's absolutely no way that our school would run without our school nurse, Jan Castevens. She has worked tirelessly to take care of the students and staff of our school since day one, and especially during this pandemic. She has such a kind and giving heart. We love her so much, and she deserves to be recognized as an exemplary nurse, employee, and person. Jen works so hard every single day, from the minute she gets here to the minute she leaves. She is stretched so thin with our large school, but she does her job so gracefully and always has a positive attitude. Again, over 30 nominations for Miss Castevens, school nurse at Franklin Elementary School. We're just so proud to recognize her and her colleagues. And we look forward to recognizing your colleagues in the month of March with a special recognition by the Board of Education to show our gratitude and thanks for all that you do and have done for our schools. This is our Leader of the Month nomination and awards is all about three things: leading self, leading with others, and changing our world. And Ms. Cass-Stevens, you certainly have done all three of those in your role as a school nurse. And I think the world knows how important school nurses are to the operation of a school, especially now during COVID. I want to congratulate you and give you a couple of goodies. We've got an umbrella here from Surry County Schools, our Education Foundation. Ms. Ashley has provided a gift basket for you. We've got a gift card from Scenic Ford, Krause's Auto Detailing, and I think another gift card from 13 Bones. And so we look forward to giving those to you, and also look forward to seeing your picture on the billboard on Highway 52 as our Leader of the Month.
For a whole month.
For a whole month. During the month of love. Would you like to say anything?
Thank you. I love my job, and I enjoy working with children and staff at Franklin. They are great. I've got a great support system there. My administrators are great to work with. And if it wasn't for them, and of course my supporters, and with the long hours and working at nights and weekends, he's very understanding. I appreciate all of them, and thank you all.
Thank you.
How much I look forward to being able to shake their hands again one day.
Yep.
Absolutely. And
I send you a hug.
we have Lori Gammons here, the assistant principal at Franklin. Ms. Gammons, would you like to say anything?
I would just like to say that we're so fortunate to have Pam with us at Franklin. She has went above and beyond to ensure students and staff are safe. And this has been a challenging time for everyone this year, but she has done strong her days and not complained. We are very blessed to have her.
Thank you for being here and supporting her tonight. Well, board members, we have some special student leader recognitions also tonight. And so I want to take a moment to recognize these students. As you remember, when we were last at White Plains Elementary School, we recognized students from the first quarter who were nominated by their principals, who had exhibited behaviors and characteristics that are contained in our leadership framework. And I mentioned the framework, leading self. We think it starts right here. Leading with others, showing that you can work in a group, showing that you can work collaboratively to get things done, cooperatively to get things done, and then changing our world. How does your leadership, your behaviors, your actions impact others, and then what difference are you making outside of school, outside of your home, outside in your community? So as we have developed our leadership framework, we felt like we have so many great examples of students leading in our schools. And so tonight we're going to recognize another group of student leaders. And the first one is right here beside of me, Miss Bella Woods, a 5th grader from Franklin Elementary School. Let's give her a big round of applause. Bella, step over here. This says, Bella Woods, Student Leader of the Quarter. We hereby recognize this certificate is for the excellent and consistent high standards of leadership shown during the second quarter of the 2020-2021 school year. Congratulations, Bella. And I want to invite Ms. Gammons back to the podium to say a few words about Bella. Ms. Gammons?
We would just like to congratulate Bella Woods for being named student leader for elementary. She demonstrates the outstanding leadership traits each and every day. For example, I just want to share a quick story. One day during announcements, she was made aware that it was a teacher's birthday. And afterwards, she raised her hand and asked her teacher, Ms. Haymore, if the class could make birthday cards for this teacher who had recently lost her husband. So she took it upon herself to lead her class to make these birthday cards and spread kindness to someone else. And she does that each and every day with a smile on her face. And so we would like to congratulate you, Bella, for what you do each and every day. And I want you to continue to spread that kindness to others.
Awesome. Thank you, Ms. Cammons, and thank you, Ms. Haymore, for being here. Now, Bella, we have some other goodies for you. Tell us who these folks are right here that are here to support you tonight. Thank you all for being here tonight. I know you're proud. So, Bella, we have for you some goodies for Surry County School swag. Congratulations. Yeah, take a picture, David. Bella, let's take a quick picture. Ms. Haymore, join us. We'll social distance. Yeah, we're standing behind her. Let's stand behind her. Pull the camera up there. We were still smiling. Thank you, Bella. Congratulations. Our next student is a middle school student, and this is Cadence Wilkins. Cadence, congratulations. Cadence, this certificate is for the excellent and consistent high standards of leadership shown during the second quarter of 2020-2021. Congratulations from the Board of Education. Cadence is a student at Surry Online Magnet School, and she was nominated by her principal, Miss Kristen Blake. And at this time, I'd like to ask Miss Blake to come forward and say a few words. And who do you have with you here tonight, Cadence? Excellent. Thank you, Mom.
Cadence is new to the Surry County school system, and over the last semester, she's demonstrated her ability to lead self, lead others, and change our world. Cadence is a dedicated 8th grade student at Surry Online Magnet School. She sets a schedule for herself to ensure that her work is completed on time. She is on pace or ahead of pace in her asynchronous learning environment. Cadence is eager to reassess and make new attempts to improve her performance. She is very poised during her Google Meets and expresses herself with great precision and respect. 2 of her assignments in ELA have required her to form a group. One was to perform an excerpt from the play Trifles. The other was to discuss a controversial topic related to the Confederate flag. In both cases, Cadence was very thorough in her organization and collaboration with family and friends to accomplish her task. She expressed in her evaluation that she appreciated how peaceful the discussion was, even though there were very differing opinions. This is evidence of her leadership skills and influence in a group. Cadence exemplifies self-motivation and integrity. As the middle school student leader of the quarter, she represents her peers, school, and community with dignity and grace, being a model student that others can look to for admiration and for inspiration. Congratulations.
Cadence, this is yours. Congratulations. Keep it up. Board members, I'll remind you, we've received many nominations for Student Leader of the Quarter, and we have a committee at the office that takes all the nominations, reads through each one, and then selects. So it's a very competitive process, and I want to thank Jody Southern for putting this together and spearheading all the work behind the scenes. Our next Student Leader of the Quarter is Lauren Knopf. Congratulations, Lauren. I'll invite Mr. Jones to the podium, but I know I've known Lauren and her family for a long time, and I've seen her participate in our Give a Kid a Christmas campaign over and over. I also see how hard she works at 13 Bones in the drive-thru. They always put their best at the drive-thru window, Lauren, so just know that going forward. Mr. Jones?
Well, good evening, everyone. This evening we would like to congratulate Miss Lauren Knopf as a student leader winner for one of our high schools. Lauren is a senior at East Surry High School, and she is the ultimate servant leader. She recently donated money to the Surry County Sheriff's Office to assist with the Give a Kid Christmas project. Lauren works at 13 Bones Restaurant and has saved a portion of her earnings last year to donate to this cause. Lauren is a hard worker and takes every opportunity available to give back to her community and change her world. And she does so seeking no recognition, but instead she does so because of her inner desire to serve others. This is not the first time Lauren has served her community in this manner. For the past several years, she has consistently served others by taking a lead role in the East Surry High School Interact Club, where she has led the charge on many service projects. Additionally, she is actively involved in her church, where she regularly serves community meals and is involved in other community service projects. Lauren understands that the experience that making someone else happy by giving it to them is truly more rewarding than receiving a gift herself. She's a leader in our school and in our community, and she certainly is making an impact and changing the world. Congratulations, Lauren. We're proud of you.
So, Lauren, who do you have here with you tonight? Thank you both for joining us. We have one more recognition, board members, and this student is going to be joining us virtually. Ms. Flippin? Ms. Dr. Badgett? Hey, Alexis. Can you see us?
Oh, no. I can't see y'all. I can't see them.
Can you hear us?
Yes.
You sure do look beautiful tonight.
Thank you.
Board members, this is Alexis Radcliffe, student at North Surry High School. Last Friday, I had the opportunity to visit Alexis at Brenner's along with Miss Amber Flippin. Alexis, that was a beautiful day. Thank you for having me.
No problem.
We recognized Alexis for her leadership. And I'm going to tell you, it was a moving day. Alexis, you have touched so many lives. But it was really special for me to see all of her nurses, doctors, take time to stop everything they were doing to see why Alexis was being recognized in the hallway. I mean, they were clogging the halls. It was they really love this girl and what she means. And so, Dr. Badgett, will you say a few words about Alexis?
I would be more than happy to. Hey, Alexis.
Hi.
You look beautiful. Your hair's pretty. Your makeup's pretty.
Thank you.
So, I'd like to congratulate her as a student leader for North Surry High School. Alexis Radcliffe is a 10th grader at North Surry, is a tenacious, resilient, and admirable student. She never misses an assignment or a Google Meet. She is often persistent with her teachers about meeting with them if she doesn't understand a concept or if she needs clarification, or calling her principal back to the computer to say something, right? She is a fierce North Surry Greyhound at heart and shows tremendous school spirit
she and I, we battle for who's the biggest greyhound, don't we? She is a perfectionist by design and truly wants to be successful in her classes. She participates in student council, is a member of course. For this semester and for the first time, Alexis has been able to access her remote classes fully independently. And she uses the Apple technology for the full remote access to all 5 classes. And I will say Miss Flippin has been very instrumental in helping make sure you have what you need, right?
Yes.
I'm jealous of Miss Flippin, to be honest. Alexis is paralyzed from the neck down, so her resiliency shows as she doesn't let anything deter her from achieving her goals. Having full access remotely to her homework allows her to have independence like most high school students strive to do daily. She is very proud of this and has worked so well with her teachers at North Surry and the Surry Online Magnet School. Last semester she had all A's, and this semester she's in that trajectory as well. So I would like to congratulate her in being a student leader, and she exemplifies what it means to be a true North Surry Greyhound student leader. Right? I love you.
We are proud of you, Alexis.
Love you too.
She said love you too. Alexis, do you have anything you'd like to say to the group?
Thank you.
Thank you. We appreciate your leadership. When I was at the hospital last Friday, she said those nurses had really touched her lives. She thought she wants to be a nurse. I thought you were going to say you want to be a superintendent.
No, I'm done. I'm done.
Hey, Alexis, just because it's late tonight doesn't mean that I expect to see you in class tomorrow too.
I will.
Okay.
We're so glad that that you're with us, Alexis. Miss Flippin, I think you're with Alexis tonight. Is that right?
I am joining virtually today.
But I decided to slack. I'm just kidding.
She's on her
Slack.
Well, of all days during COVID-19, I had to be in quarantine today. So I am with Alexis virtually from my house. And I'm so glad that she has been able to join us. She is an inspiration to me, and I am so thankful for the opportunity to be able to work with her and her amazing team at Brenner's, and the way that they support her. I fully anticipate Alexis is excited, was asking me yesterday if I thought she could get scholarships to college so she could be a nurse. And I told her I absolutely thought that was a possibility. She wants to be an Appalachian State Mountaineer in a couple of years. And she teaches those nurses at Brenner's and those not the nurses, but the students at Brenner's how to change her trach and how to work her vent and all the things. And she is a great self-advocate and a true example of leadership in the best form. So thank you to Alexis for loving Surry County schools.
No problem. Are you okay? Are you crying?
No, I'm not.
I don't believe you.
I want to thank all the staff at Brenner's for showing Alexis so much love and care. Thank you, thank you, thank you. Miss Flippin, thank you for working with her. It was a joy to be with you last Friday, Alexis. Congratulations.
Oh, that's nice.
So, board members, we have Dr. McGann who's going to join us from the ABC Science Collaborative. We originally didn't exactly know, so we said 5:45. So if it's okay, we can amend the agenda and bring her in when she was seeing patients this afternoon.
Mr. Drone is actually follows her.
Yep.
He can get done in 15 minutes.
Yeah.
Mr. Drone, thanks for joining us.
Good evening, board members. It's my pleasure to come back to you again this meeting with a quick update on our construction projects. So we will start with Dobson Elementary. So at Dobson Elementary, you can see in this photo that they have installed the second piece of the storefront, which is an airlock. There are one on each side of the new addition. This one is actually going out toward the playground, and then you have the same airlock system on the side coming down from the 1990s building. So they also have set all of the HVAC air handling equipment up in the mezzanine. They have connected the ductwork. They have insulated the ductwork and also ran the line sets to each one. So we're very close on being able to condition the building in the coming days. They've also been working this week on running all the data, cabling, as well as fire alarm and intercom cabling. They also have began the tile installation in the upper level gang bathrooms. They have delivered the serving line equipment for the kitchen. They've also set in place all of the new equipment that is under the hood, the new cooking equipment. The freezer and cooler has been installed, and today they were hooking up the refrigeration units to that. And they have completed the connection, the corridor connection to the gym with the new storefront, which you can see here, missing a piece of glass which should be coming in the next few days. And we are actually started this week being able to utilize that connector on one half of it, so the children now can come out and go to the gym through this connector. There's still quite a bit of work to do in that area, but right now most of it is taking place on the right hand side, running HVAC ductwork, getting all that going to condition that space. So they had the majority of the ramp finished, handrails are up, so they were gracious to partition that off so that the children could utilize that to get back and forth to the gym. Also today, I don't have a picture, I apologize, but they were completing the roofing panels today on the roof. So we should be dried in hopefully by week's end for that building. So I'll be happy to answer any questions you may have for Dobson Elementary. If not, we'll move along to Franklin. So this is the upper level access to the elevator. So you can see they've gotten the majority of that area, the finish is done, as well as you can see where they have the elevator shaft is in place and the doors and all have been installed. This is the lower level, which comes into the dining area. Hopefully that will be completed in about one more week. That should be operational. This is the serving area, so that it's been put back together, and I think Mrs. Park's staff have came in and cleaned a lot of this equipment up and got it ready to go. Also in the kitchen under the hood, all the equipment has been set in place. The next step will be to get all of that equipment under the hood wired up and operational. We're actually waiting on Captive Air, which is the company that installed the hood, to come back and make some minor changes to the electrical service so that these pieces of equipment can all be tied in properly. And last month I showed you the dumpster enclosure. Now it is 100% complete. So you can see the gates have been installed. The privacy slats are in place. So this area is ready to go. So that's Franklin Elementary. I'll be happy to answer any questions you may have. So we'll move along to Mountain Park. So at Mountain Park, they have paved and striped the new student pickup drop-off area. And you can also see that they have installed the front canopy. And next step will be to brick the columns and run the electrical lighting and things to that area, which they are currently working on now. So this is looking down the hallway of the 1950s building. So you can see that they have the ceiling and lighting is in place. Got the tack strips up, bulletin boards are up. This is a classroom on the back side of the building. So same scenario, all the ceiling grid lighting's in place, casework's in place. And you can see where they have skim coated the floor, so the next step will be the installation of the VCT tile. And this is just another classroom, different angle. This is the media center workroom. So there was a glitch in the cabinetry. They have corrected all that with the proper maple cabinetry versus the blue. I think last month when I showed you pictures, there was blue cabinetry in there, and that was an error, and they corrected that and made that right. So ceiling grid's in place. Heat and air vents are hooked up to the ceiling grid. They just need to get their overhead inspection, and they will be able to put the ceiling tile in place. This is just another view standing from the other angle of the workroom in the media center. So you can see here they've installed the ceiling grid. They've got some of the ceiling tiles in place. Those are the access points to hang the lighting. So they were working on that, currently working on that. And next week they'll come in and prep the floor for finishes. They've also opened up the hallway down to the new connector corridor. They did have a temporary construction wall up in that area, and they have taken it down and opened that up. So the heat is now working in that area, lighting and everything. So the next step will be to, again, the VCT flooring will be the next big push in that area to get all of that done. So that's the latest and greatest at Mountain Park Elementary. So do you have any questions? Thank you. Thank you.
One schedule change I'd like to make during the month of February. February 23rd, our high school calendar, we have the ACT. That is a date that is set at the national level. All high school juniors must take the test. Based on the social distancing measures that we are required to adhere to, we need to transition to a remote learning day for 9th graders, 10th graders, and seniors so that we can accommodate all juniors face-to-face at all of our high schools. So I'd like to just make you aware that we plan to make that transition on February 23rd, and just make sure that you are aware of it and ask if you have any questions. And it's totally, we've got to make sure that we have the space, we've got to make sure that we have the people, and we just can't do it with the current number of students that we have coming back on the A cohort, B cohort, and to get all of our juniors there for the ACT.
So the Friday will become a person that week on, correct? Is that Tuesday will be the
I hadn't planned on taking that Friday as a remote day. I was going to leave that Friday as a remote day, just transition that Tuesday for high school only. High school freshmen, sophomores, and seniors only.
So it only affects the A
Yes.
cohort that week?
Yes.
Okay.
Everybody okay with that?
Okay.
Think you're good to go? You want to do a motion?
Yes, that'd be great.
Okay, do I have a motion to approve that calendar change? Motion from Mr. Badgett, have a second. Second, Mr. Goins, all in favor? Any opposed?
Thank you. The next item under my report is an update on the Governor's Emergency Education Relief Plan. This is a plan that Ms. Luann Llewellyn, Dr. Danley, myself have been working on. In PRC 169, Specialized Instructional Support Personnel for COVID-19 Response, we have received $209,000. In PRC 170, Supplemental Instructional Services, we have an allotment of $100,000. And Dr. Danley has put together a plan, and I'll just turn it over to Dr. Danley to present that plan to you.
Thank you, Dr. Reeves. With the PRC 169 Specialized Instruction Support, we would like to hire a contracted part-time school counselor for our online magnet school. They need some help in that area, especially high school, with all of the college courses getting registered, with making sure they're on their four-year plan path, getting students registered, and then also to have for all of their students that social emotional support. And this funding does go through December of 2022, so it would help us hire some part-time school counselor support for the online magnet school. Additionally, these funds can be used for hiring nurses, school nurses, and will help us pay for our 5 CNA interns that we have in our building. So that really helps us make sure that our schools have nurses and CNAs in our buildings. And then additionally, we are looking at hiring a graduation coach for our high schools. This person does have to have either a degree in school counseling, school social work. This would be a part-time position, and we are hoping this will help our students on their career paths, help with credit recovery, help them with any counseling they need for jobs, any college courses, really to help our principals, assistant principals, our current guidance counselors. But we have some students who we know that the pandemic has impacted, and just another person to offer some support, and also to help what we would like to propose using PRC 170 funds, which would be a twilight school for our 3 traditional high schools there. We can use that supplemental instructional service funds to hire some tutors to help these students with credit recovery, and we would have those at our traditional high schools. Then our early college students and online magnet school students can attend in their home neighborhood school. And we would look at doing that in the afternoons, the evenings, 4:30 to 7:30, hiring part-time tutors for that. A lot of students do work during the day, some of those juniors and seniors, and they're helping their families, and so we feel like this would be another way to help those students get caught back up on their four-year high school plan. And I did work with Dr. Mosley and the curriculum committee on this, and had their full support.
The curriculum committee approved this proposal. So, are there any questions?
I have a question about the contract. Would that be a single individual contracted through them, or could that possibly be the person would change? Do we know?
I do not know that. For the nurse.
It's one person, yes.
And you know who that person is, and this would be the person?
That's the person.
Okay, for both of those positions?
we would put them in a school. They would work in the schools. Yes, and then help.
Does this kind of fill it in where we lost those people?
It's a different position, Mr. Coe. It's really a position that's going to be utilizing the Apex Learning Credit Recovery System that we purchased. It was either last board meeting or the board meeting before. This Apex Lab, this graduation coach is a, like Dr. Danley said, a part-time counselor, but it's really a person to run that lab, to really work with these students in a one-on-one capacity in helping them make sure that they are on track to graduate, giving them another set of resources and another set of hands. The funds are temporary. We also envision this graduation coach possibly, and I've talked to the high school principals. We have a meeting next week with a high school principal in Guilford County who has a graduation coach and who also has an Apex lab, and we're going to learn from the principal there at Page High School how have they utilized Apex Learning, how have they utilized their graduation coach. I had the opportunity to use a graduation coach at Eastern Guilford when I was principal there. This person specialized in math, specialized in the credit recovery piece, and really was a person that kept kids and held them accountable, both during the day and in the evening. I could envision this person having a flexible schedule where they come in, maybe, I'll just use this example, maybe they start their day at 12 o'clock and they end their day at 7:30 p.m. Maybe there's a day, an evening, that the lab is open later than 7. Maybe there's a situation where the lab is open on a Saturday morning. I just feel like we have to work with all of our students that have had difficulties during the pandemic to help them get caught up. That's the vision for these positions as we've linked in that job description.
And
It'll be located at the high schools. No, the coaches will be assigned to, there'll be one part-time graduation coach for North Surry, one part-time person for East Surry, one part-time person for Surry Central.
Sorry. I apologize.
Yes. We have not. Less than 30. Less than 30 hours a week. We're really looking for a retired person, and we know that if we find someone retired, they'll have to work less than 30 hours a week.
Do the students have to be on campus to access Apex? Or is this just set up so that for extra help along the way? If they've accessed it at home?
To my knowledge, the students do not have to be on campus. However, we have students on campus that will need the help. This person, there's a good chance this person is going to be making tons of house visits, home visits, holding these folks accountable to help them get caught back up, not only during the school year, but also during the summer. I envision that we're going to continue to have, we know that we're going to have gaps and we're going to have needs beyond the end of school in May. Also have some knowledge that I think the General Assembly is going to be pushing forward legislation that will give us more funds for a catch-up summer school, catch-up camp this summer. That could be an extended school year kind of option for our students. So that's another opportunity. I just know that we have students that need help, and in looking at these funds and the way they can be spent, I've been successful with a graduation coach in the past, and I think this position could be utilized really well here in Surry County. Okay, great.
All right, any other questions on this?
I'd just like to make a statement on that. In response to your question, my experience teaching in high schools, they get more benefit out of it if they are at the school.
Sure.
One of the reasons they're falling behind is because they're at home and they don't have the structure, so I think being in the school would be a big key to their success.
This would be targeting those students who have not been successful with the remote option. So, do we have a motion to approve this funding?
Yes, Dr. McGann, can you hear me? While Jeremy's getting us connected, Dr. McGann is the Vice Chair of Education, Department of Pediatrics and Division of Infectious Disease. She's also the Dr. Glenn and Muriel Kaiser Professor of Pediatrics at Duke University Medical Center. She is a member of the ABC Science Collaborative, a group that we are a part of. Doctors have been helping school systems throughout the pandemic, and the ABC Science Collaborative has been leading this work from the early fall. We appreciate all the work they've done with us and also across the state of North Carolina and nation. We have a regular call with the ABC Science Collaborative in which we're able to ask questions and engage in directly with medical professionals. And I can't tell you how invaluable that's been during this very difficult time period. Dr. McGann, can you hear me? Dr. Mosley, would you like for us to go on one more item in the COVID-19 response while we're working through this? Okay. So I'll jump back in. I think that concludes the information from the superintendent's report. I'll turn it over to Dr. Danley. She has 3 items.
Good evening, Board. One of the things that Mrs. Sutphen, you had asked last month, what are we doing to help our staff to help with COVID fatigue? And I have attended a session with Dr. Steve Scoggin. PTEC, Dr. Lily Cox worked and organized several sessions for our PTEC collaborative group, and several of us at the central office, Mrs. Southern, myself, Mrs. Key, Mrs. Holmes, attended his sessions, and we were just delighted with what he had to offer, strategies for making sure that we could help us with this COVID fatigue. And so we are delighted to have 3 opportunities for our staff to present. So I think is she?
Oops. Can you all hear me?
Hey, we're great.
Yay, sorry about that. I switched to my laptop. It's a little better. I'm going to try and get my slides up.
Well, Dr. McGann, we appreciate you joining Surry County Board of Education tonight at our board meeting. We have 5 great board members, and we appreciate the work of the ABC Science Collaborative, not only for helping Surry County schools, but all school districts across North Carolina. Thank you for joining us.
Absolutely. Perfect. Thanks, Jeremy. All right. So the ABC Science Collaborative is really a public health initiative that, with the goal of uniting science in schools to ensure a safe learning environment. You can go to the next one. And so Kenesha Zimmerman and Danny Benjamin are our 2 co-chairs who really first thought about this. And they're both very invested in the need for school attendance while understanding risk factors associated with COVID-19 as an urgent unmet public health need. The need that our local superintendent said was that they needed up-to-date information to help make decisions about returning to school. And those decisions impact, obviously, the health of our teachers, our staff, our children, our families, and really our communities overall. And we need to feel confident that our children are returning to safe learning environments along with our teachers. Next slide. So what is the ABC Science Collaborative? It really is a group that pairs scientists and physicians with school leaders and community leaders to help understand the most current and relevant information about COVID-19. We are funded by the NIH. And I do have to say, and you all know this, that the science around COVID-19, as Dr. Reeves knows, is changing pretty quickly. And so there's constant updates. Next slide. So this is our team. Kenesha and Danny, as I mentioned, are the co-chairs. And then there's a group of us who are infectious disease physicians, general pediatricians, epidemiologists, all working together. And I should have mentioned to you all, I am a pediatric infectious disease physician. and am also vice chair of education within our Department of Pediatrics. So my education is a little different than yours, where I oversee residents and fellows training to be pediatricians, and also oversee medical students. So we always joke that for us, our biggest issue is keeping our learners awake. That's not usually the issue in K through 12. So next slide.
It can be an issue.
Our big goal is to help answer pressing questions from parents, teachers, principals. And the key tenet of this is that we've been meeting with superintendents on a bi-weekly basis, as Dr. Reeves knows, where we spend a lot of time talking about the new science. And then the other thing that's been really helpful is the superintendents are able to have a lot of peer-to-peer discussions, talk about the most recent challenges they've encountered, and discuss both the science and solutions that others have found. Next slide. These are the districts we serve. We've served 56 districts within North Carolina. Next slide. And then just wanted to point out, we've created existing partnerships with the North Carolina DHHS, to which Danny and Kenesha presented many times, the National Institutes of Health, our local American Academy of Pediatrics. It's been really important to meet with the North Carolina Association of Educators, and Danny and Kenesha do that on a weekly or bi-weekly basis and help answer teachers' questions. And then just to let you know, we have started expanding nationally and have partners in these other states, as noted. Next slide. So the ABC Science Collaborative has several different aspects. The key is the one I mentioned, so informing evidence-based decision-making by applying the science that we know and that we're learning with the superintendents, the state health department, and other stakeholders. And then if you all want, you can all go online to the ABC Science Collaborative and see the webinars that we have. And there's webinars from all kinds of things, why we mask, to extracurriculars like band and sports. And then we also have an app for districts who've been interested in an app in order to track people on a day-to-day basis. And that's explored more on the next slide. So the app is that parents can sign their children in and use the app. Schools, different districts have used this app to start screening, and then also to fast track any contact tracing that needs to be done. And then you can go to the next slide. So I just thought I'd go into some of the science that we talk about on our superintendent meetings, and then some new science that came out last week. So on this slide, we see to the far left that there was an outbreak in a Salt Lake City daycare center. And this was one of the earlier outbreaks. And what they found is that if teachers masked, used hand hygiene, that was able to stop the outbreaks. And then I'm going to jump just in order to save time to the far right. This is one of my favorite examples that really demonstrated that masking works. So there were two hairstylists, both of whom developed COVID-19 disease. They were masked, their clients were masked. They had overall 139 clients that they exposed, and none of those clients developed COVID-19 disease, again showing how important masking is. And obviously they were not totally distant and spent anywhere from 15 minutes to over an hour with their clients. So this was encouraging data. The other thing I should point out is that early on, when schools were opening, we used a lot of what we had learned in the hospital about what was safe and what worked to protect us. For example, the outbreaks we had were often not from our patients to our staff, but staff to staff. And when that happened was in break rooms, when people were eating together, unmasked, and not 6 feet apart. And so we learned from that to to let you all know that those kind of things were happening, and to have teachers avoid eating together in break rooms to avoid spread. Next slide. You all have probably seen this data, but this is earlier this week, the total number of new cases in the United States is on the left, and then the new cases in North Carolina on the right. And this gives us some room for cautious optimism in that the numbers are going down. We do know, though, that certainly over the holidays, Thanksgiving and Christmas, when there were multiple gatherings, that the numbers went up, and we are concerned with the variant coming, which is more transmissible, that if people do not continue to be vigilant and careful, that the numbers could easily go up again. Next slide. And then I just want to talk more specifically about data we have in schools. Next slide. So this came out from The Atlantic on the left in October, where a group from Brown has been tracking transmission in schools and has demonstrated that schools are not super spreader events like other places we have seen, other events. They tracked 200,000 students in 47 states from the last 2 weeks of September, and even early on showed a very low infection rate of children and staff within schools. About 1.3 infections over 2 weeks in a school of 1,000. So that's significantly lower than we would expect with community spread. And then we were really excited when other countries were also able to demonstrate decreased spread in China, in France, in Australia, again in schools. And next slide. And next slide, there we go. And then just to bring it home and talk about North Carolina, next slide. The ABC Science Collaborative, with help from several districts, compiled data on the incidence and secondary transmission of SARS-CoV-2 infections in schools. Next slide. So there was low secondary transmission within schools. And I just want to point out, so when we talk about secondary transmissions, so we know people are infected in the community. We know people are going to come into school with SARS-CoV-2 infections because it's out in the community. Our big goal is to prevent in-school transmissions, which we refer to as secondary transmissions of SARS-CoV-2. So our goal was to describe secondary transmission within North Carolina public school districts who were in hybrid schools for the first 9 weeks. So 11 of the 56 participating districts, so 11 out of the 56 schools were open for hybrid or Plan B instruction during the first 9 weeks. There were 90,000 students and staff, and a wide range of local community prevalence. So anywhere from 200 to 900 cases per 100,000. So pretty big spread within some of those districts. There were 773 community-acquired infections, so individuals that walked into school with SARS-CoV-2, but only 32 infections were acquired within the schools. And this was determined by the local health department contact tracing. So normally, with 773 community-acquired transmissions, in the community, with usual transmission rates, we would have expected 800 to 900 cases resulting from the 773. Instead, we only saw 32. So this was super exciting to see this, that really with using the mitigation strategies, we could really decrease in-school transmission. And this is really due to you all, and you all are seeing this in Surry also, where you've had markedly low transmission rates within school in spite of community transmissions. The other cool, interesting thing about this was there were no instances of child to adult transmission of SARS-CoV-2. And most of the secondary transmission cases were related to lack of face coverings. So there were a few again, in break rooms where teachers were eating without masks and were close to one another. And then early on, there were pre-K, there were some pre-K classes where the children were not masking, and there was some spread. However, we learned that and realized that pre-K children were good at masking. There were no further transmission. So the conclusions were, in the first 9 weeks of in-person instruction, there were extremely limited within school secondary transmission. So the data support the concept that schools can open and stay open safely in communities, even when those communities have widespread transmission. Next slide. So the contributors to success were the daily screening of students and staff. Just like you all, Dr. Reeves shared with me you all's very detailed plans to prevent transmission, where you basically figured out what would happen when the child appeared at the door all the way until they left for the school day. So everything that needed to happen, including in special needs classrooms. High rates of mask adherence were very important, and I have to say our children are doing incredibly well at wearing masks. Sometimes we have issues with the adults, but that's getting better. And then transparent public reporting of confirmed infections. The other key thing is the close collaboration that our school districts have had with the local health departments who've helped with tracings. And then the biweekly meetings with superintendents, again, where there's been peer-to-peer sharing of lessons. And then any updates, we've definitely provided updates to principals, staff, and boards of education, whomever wanted additional updates. Next slide. So this basically demonstrated high rates of COVID-19 in the community do not mean increased secondary transmission in schools if there is very close adherence to the 3 W's. So schools are doing a good job of protecting their students and staff, and you all have seen this in Surry. And so now I just wanted to share some additional data that's reconfirmed this, that came out over the last week and a half. Next slide. Oh, sorry. So first, and Dr. Reeves has seen this, as a result of this data, we have, with help from the superintendents and the health department, compiled the 12 principles. So we start with the 3 W's, the watch your distance, wear a mask, and wash your hands or use hand hygiene. And then the next is to be transparent about cases and make sure that the cases are reported to the health department. To make a roadmap for contact tracing, again, in conjunction with the local health department. Developing a dashboard. Implementing lessons learned. So as I talked about with the pre-K setting, in some of the adaptive curriculum, there were several lessons learned that we could implement to decrease secondary transmissions. Working with a trusted third party to analyze data, to leverage the school-based metrics. Next. And then I just do want to mention, we are seeing some pandemic fatigue. I think all of us are really sick of not being able to go to restaurants and not being able to see people's faces and having to continually wear masks. So we are having to make sure that we combat that, and really, just like you all have been really good. I know Dr. Reeves was telling me that he has been making visits to the schools to try and really encourage mask adherence and adherence to all of the 3 W's. The detailed schedule that I mentioned, thinking about very carefully about extracurriculars and how to think about athletics and wind instruments very carefully. Thinking about the special needs children as far as those who can't wear masks, seeing if they'll wear face shields, and then thinking about if they won't wear face shields, having the teachers wear masks and face shields and other protection. A really nice communication plan, which you all have clearly developed. And then, as Danny has said many times, let's walk and then run. So starting with hybrid and then gradually expanded to plan A when things are working well with hybrid schooling. And next slide. And we think of this as the Swiss cheese analogy, where we really recognize that distancing, ventilation, masking, hand hygiene are all key. There's no single intervention that's perfect at preventing spread of SARS-CoV-2, but multiple approaches improve our success. Next slide. And this was super exciting to all of us when the CDC in December came out with this statement that because of the critical role for all children and the disproportionate impact that school closures can have on those with the least economic means, K through 12 should be the last settings to close after all other mitigation measures have been employed, and the first to reopen when they can do so safely. And they based this on early data. Next slide, thanks. And then this was, so this was what I was referring to that came out last week. This was a data and policy statement to guide opening schools safely. They made this statement, and this was from JAMA, which is a Journal of the American Medical Association, that the preponderance of available evidence has been reassuring, and the rapid spread seen in other settings has not been reported in schools. So in fall 2020, again, we went over this, the 11 school districts showing only 32 in-school transmissions. Then they also cited another study. This was in Mississippi, where children 0 to 18 were followed, and they actually looked at children with and without infection and found that those having attended gatherings like birthdays, funerals, weddings, and other social functions outside the home, as well as those who had visitors in the home, was associated with increased risk of infection. However, and this is key, in-person school attendance during the 14 days prior to their diagnosis was not associated with increased risk of infection. And the next slide shows a nice infographic, basically bringing home this message from the Mississippi study. Again, that there were children with SARS-CoV-2 were not more likely to have attended school, but were more likely to have attended gatherings. Next slide. Further confirming this, there was a study that just came out last week in Wisconsin, and this was reported for the Centers for Disease Control. They looked at 17 schools that were K through 12 that had very high mask adherence. It included 4,876 students and 654 staff. And they again demonstrated a markedly lower COVID-19 incidence in schools than in the community. They looked at 13 weeks in the fall. There were 191 cases in staff and students that walked into the schools, but only 7 cases determined to result from in-school transmission. And the next slide shows a nice infographic of this that I think is helpful to share to again reassure people that if they follow masking, distancing, and hand hygiene, they can look forward to low risk transmission. And then next slide. So this is fun. They actually demonstrated the total cases in this county in Wisconsin is the black line. The total cases that were in the school districts, and then the cases attributable to in-school spread, which is markedly low. And the next slide sort of blows this up a little more. And again, you can see total cases, and then the arrow demonstrates cases attributable to in-school spread, again, markedly low. Next slide. And this is where I'm so impressed with the children. In that we are seeing this in our North Carolina schools also, where mask adherence is generally over 90% and in many settings over 95%, except for in the adaptive curriculum where it's closer to 50 to 70%. Next slide. And I think I'm just going to say that we only have very preliminary Plan A data, but again are showing very, very low secondary transmissions in the setting of Plan A. We are compiling more of that data shortly. There is some evidence intermittently of pandemic fatigue and people not masking, and that is where we start to see secondary transmissions. Next slide. So these studies basically demonstrate that schools can mitigate within school viral transmission despite the level of cases in the community, especially when teachers, staff, and students consistently wear masks, use hand hygiene, and distance. And brought home the point that decisions around in-school learning should be made by each school district in conjunction with their local public health department. Next slide. And you all know this much better than I, but there's major educational and child health impacts from the pandemic. Our superintendents are reporting declines in beginning of grade testing, changes in iReady results, course failures, dropout rates, and are concerned about decreased graduation not only this year, but in subsequent years, and clearly creates some parental stress. In addition, next slide. And you can keep paging down. There's food insecurity, child neglect and abuse. Unfortunately, we are seeing increased rates in children who are in virtual learning, social isolation, decreased physical activity for some, and then mental health and behavioral health issues such as, next slide, anxiety, depression, and suicide. Our psychiatry colleagues are very concerned about the rates of depression and increased rates of suicide due to the pandemic. Next. And then this is where I may have to have you do some changes because I've changed these slides a little bit, but did want to touch on the vaccination. Next slide. So we are super excited about how quickly they were able to get out the vaccinations. They had a lot of studies that have been done previously with these new mRNA vaccines. And you can see they started with 40 vaccine candidates and then are now down to 8 that are in early or limited use. And the 2 that are approved for emergency use by the FDA are the ones you're familiar with, and they're the ones on the top, the Pfizer and Moderna vaccines. Those are both mRNA vaccines. They have very high efficacy, 94 and 95% protection from severe COVID disease. We are all very excited for them. I got my first one on Christmas Eve and my second one a couple weeks ago. And the other one that you've heard about coming out are Johnson & Johnson and the AstraZeneca, which also have relatively high rates of protection. Next slide.
Dr. McGann, I think Jeremy's trying to get to the email to get your latest slide deck.
Oh, okay, cool.
You want to pause and just see if the board has any questions while he's transitioning?
Absolutely.
Are you good to go? Jeremy's good to go, Dr. McGann. Any questions up to this point? Okay, seeing none, please move forward, Dr. McGann.
I'm sorry, I missed that. Any question?
No questions as of yet.
Okay, and then you all probably know this, but the vaccines have rolled out, and North Carolina has done a pretty darn good job. So they've rolled out to healthcare workers and long-term care staff and residents. Those over 65 have been starting to get it, certainly in our area, and I think in your area. Is that right, Dr. Reeves?
Yes.
And then the next hope is that frontline essential workers, and I have to admit, I'm not sure in Surry where you are all with the vaccine, if teachers and staff are starting to be vaccinated.
So our essential workers, 65 and, or excuse me, our older adults, we've identified all of our employees 65 and over. They have had a shot, or those that wanted a shot, they have been identified, and that we're still working through the 65 and older active group. They're number 2, group 2 in Surry County. we have vaccinated our healthcare workers and those that are, we are a pilot district for the antigen testing. And so our school nurses and any other school personnel that are delivering the antigen test, they have been vaccinated. And we are ready to submit all of our names of our other employees that want the vaccine in group number 3. We're just waiting for our local health department to give us the green light. They are doing a good job of vaccinating people in Surry County. We have a close connection with our health department, and we're working really hard to make sure that our essential workers, our teachers, our teacher assistants, our principals, those people who are in our classrooms day in and day out, right there with our students, have the opportunity for a vaccination.
Awesome. Yeah, that's terrific. We are really encouraged by the vaccine. And if you can't find it, there's only one more slide that really is talking about, the bottom line is SARS-CoV-2 is not going away anytime soon. We do have to continue to be vigilant with our masking, distancing, and hand hygiene. And the vaccination is going to be absolutely crucial to decrease spread locally and globally. The vaccine for children is still not ready for prime time because those studies are still being done. But obviously vaccinating frontline essential workers and our teachers and staff is going to be absolutely crucial. Any questions?
We're supposed to hit this super spreaders, what, in March, April? Do you think we'll have all our teachers vaccinated by then? All our educational people?
So I had a little trouble with the question, but it sounded like asking about this variant that's more contagious. Was that right?
Yes. I understand they're coming through in what, March, April, in that time frame. Is that true?
Yeah, so the epidemiologists are predicting that this variant that's about 30 to 50% more contagious may be the more predominant strain that we see in, you're exactly right, March or April. The one really good thing is that masking, the same mitigation procedures that we're still using are very effective against this new variant also. But your question was also if the vaccine would be administered in time. Was that the other aspect?
Yes. Do you think we'll have enough vaccine in North Carolina to have our educators vaccinated by that time frame? Or do you see?
It's going to be variable in different parts, and different health departments have been more successful in rolling out the vaccine than others. I am optimistic that the more people we get vaccinated, that will hopefully protect us from another major surge of the new variant. I'm hopeful, but we don't know yet.
Okay.
And there, not to go into it too much, but most of the variants, the current vaccine will be protective. There are some variants where it may be slightly less protective, and the companies are already working on a booster, which is awesome, to more directly address those variants.
Let me ask you this. How much of a super spreader would it take or would happen that we would have to shut down the schools again? What percentage are you looking at, if, or do you have any?
Yeah, it's an interesting question. Just to make sure I heard it correctly, what percent of community spread would make us think about closing down the schools? Was that the question?
Yes, that's correct.
Yeah, so what these studies have shown us is that community spread does not predict spread in the schools. And the schools have been very successful, even in December when our rates were quite high in the community. Many of you all school districts have been very, very successful staying open. So our message has been that community spread is not going to be what's going to close down schools. It's really if the schools are starting to see clusters. The only other risk, and the other thing that impacts the decisions, and obviously Dr. Reeves and the health department would make these decisions, but the other issue is if there are so many staff out either because of COVID or because of quarantine, which is the bigger issue, quarantining, are there not enough adults in school to safely open some of those classrooms? So then those decisions have to be made around, are there adequate staffing to keep schools open? So the clusters make us step back and take a look and decide what to do. And then the staffing of either the classrooms or the schools are another key aspect to consider. I hope that answered the question.
Well, I don't think we have an answer to that question, but that's close. Thank you.
Dr. McGann, on behalf of the board, thank you for the guidance that you have provided, and I know that we can look forward to your continued guidance as we move along this journey. It's great to have the science to go with the decision making. It's been challenging for all of us, but I trust that you will still be there as we go through the spring, and we do appreciate you.
No problem. It's a pleasure talking with you all. Sorry about the technology glitches.
Thank you, Dr. McGann. I really appreciate you taking time out of your busy day. I know you've worked a full day and then have squeezed us in here at the very end. So thank you for all your energy and effort on helping North Carolina school districts serve our students.
It was my pleasure. You all have a great night.
Thank you.
Thank you.
Take care.
All right, so I think, Dr. Danley, you were in the middle of talking about coping with COVID.
Yes, so as I was saying, we have scheduled 3 sessions with Dr. Steve Scoggin from Wake Forest Health Medical Center. He is on staff there as a counselor as well, and he will be leading the session in COVID fatigue. I found it very helpful. I found it very hopeful. He talks about strategies that will help with COVID fatigue, things that you can do that nobody even knows you're doing. He talks about how it's okay to have anxiety, and I left with a lot of hope. And I just felt so, I was glad I participated, talked with principals that participated, and we're very excited to be able to bring this to our staff. And I will have Mrs. Freeman email you all the information so you can, if your schedules allow, you can attend as well. It was just a very powerful session. 1 hour, but it helped me a lot, so I'm excited about being able to bring that to our staff members. And we will be recording this session for those who cannot come during any of these appointed times. So we'll have flexibility because I do want Mr. Hardy, Mrs. Parks, Mr. Brown to be able, we want to be able to provide this to all staff, not only just, not talking about teachers and teaching assistants, all our staff members. The next thing that I would like to talk about is our Canvas learning management system. We know that Power School Learning Haiku they are just closing that whole learning management system. So Mr. Gillespie has worked on a visual and a reminder for our principals and teachers to get us to the end of May. And our Friday sessions for teacher support on the days we have remote learning focus on helping our teachers prepare for Canvas and give them time to work within their PLCs, their professional learning communities. And heard from a principal today about how helpful that had been, the role that Mr. Gillespie had played, how it helped them, and then the digital learning leaders in the school, just meeting with them, helping them get their items transferred from Haiku to Canvas.
really have eased some anxiety. They're learning the program, and being able to provide that scaffold of support so teachers are ready. And I think the feedback Dr. Reeves and I have gotten on our school visits, teachers are feeling a lot better about this. So we intentionally have a focus and a plan to help them get ready as they transfer all of their digital items into Canvas. And that's all of my part for curriculum instruction and the COVID update.
Thank you again for pushing off the Canvas transition. I think that
Yes.
that was something we heard in our visits to the schools that was drawing a little angst. So appreciate the delay in pushing it off for the teachers. Mr. Vi, I think you're next.
Okay, thank you. Some of what has already been covered, the COVID vaccine update, and that we did submit 65-year and older employees' names to the health department. A lot of all of our nurses who wanted the vaccine and folks in the building who are doing the antigen testing in the school. A lot of those have received their second vaccine now. We are ready, as Dr. Reeves mentioned, to submit the names of our other employees to the health department once Group 3 is ready to go, to send those names in for those people who wish to receive the vaccine. We are working with the health department on case investigators and contact tracers that will be devoted to the schools, and we're really excited about that, where we'll have case investigators. And what case investigators are, they are people that deal directly with a positive case. And they investigate and they find out they give them the dates of their return, but they also find who was in close contact of that individual. That information is compiled, given to a contact tracer, and the contact tracer reaches out to the individual to let them know that they were a close contact and here are the quarantine dates, and that will be in a spreadsheet. So our district, in working with them, we've always had a close relationship with the health department, and positive cases and quarantine folks who are close contacts, but these are people that are be devoted strictly to the schools. So it will be a point of contact for our nurses, so that they're help making the call, and our nurses aren't always making the call and determining dates. So it's a point of contact that our nurses will have in reaching out to positive cases, but also folks who are in quarantine, and making sure that the dates are right for return. So we're really excited about that. We have talked about it this week, and we have a meeting with the case investigators and contact tracers next Wednesday. So we're excited about getting that up and running.
Thank you. I'm sure the nurses
people
are
were
excited
involved,
too.
Kevin?
The numbers, we're not sure of quite the numbers of contact tracers. Right now we would have 3 investigators that have been assigned, but they're working on the contact tracers to get us more. So we'll know next week a little bit more about how many.
What's your thoughts on how many we need? I mean, just for curiosity, do you have a number in mind?
I would think on the contact tracers, 3, 4, 5 would be where we would need case investigate, because that's a lot of phone calls. That's a lot of calls to make. One positive could
roamed around the whole day.
Yes, it could. It would take. So that would be taken off some of the nurses to do, their job and help them out a great deal, because they're working past hours now to make all of these calls and weekends. And these case investigators and contact tracers will be available on Saturdays as well. So it will help on weekend.
So the nurses have been doing this up to now?
A lot, yes, sir. Working in conjunction with the health department, yes, sir. They have been.
Mr. Coe, so this is brand new, and Samantha Ainge, I'm excited that they're providing this resource, But before they came to us, we were prepared to hire our own contact tracers to do some of this work, to take it off our nurses. In fact, I was wanting to hire one per district part-time, and I've already got 2 confirmations. So I guess what I'm saying to you is this: if they don't provide enough people, I feel like we need to step in and provide some additional folks, and we can do that through some of the COVID relief funds that we've received, temporary basis. But I think that's what we've got to do to get through this spring up until the end of the school year, is continue to support our nurses, support our schools, to make sure that we're doing all we can with contact tracing. The health department is diverting more resources to vaccination and contact tracing as a whole in Surry County. They're focusing on 2 groups: school systems and healthcare facilities. And that's it on contact tracing, because they're having to divert more attention to vaccination. So I think it would behoove us, we'll see how this goes and see how many people we have, but if it's not enough, I would recommend that we reach out and hire some independent folks employed by us to do the same work.
Do you see our nurses giving the vaccinations if they get enough rolled out, or is that not a thing they could do?
I haven't heard anything
Yeah, I haven't.
on that.
Don't know what.
I haven't heard. I have heard that.
I figure some of them are as good as ones at Walgreens, don't you?
Absolutely. And I know that our people would step up and do it if asked. They sure would. I do believe the health department has a good system for vaccinating folks, and they're trying to make it as efficient as possible. And Samantha has said over and over she wants to make sure that she uses every vaccination that she has, and so she's working with us all she can, given everything else that's going on. I'm really excited today. Was it yesterday? We were at Westfield, and we had 2 new CNA students from Surry Community College, and so they were being trained by Nurse Danielle on how to do vision screening. And so I'm excited to know that the CNAs that we're taking, either they're our students or Surry Community College nursing students, can do some of the work that our nurses were doing, vision screening and some other things, to help take some of that off of them. So we're working through that. It's not perfect, but we've given them some additional support second semester. Some of the Bayada nurses worked out great first semester, some didn't. So we're working through all that. Second semester, we have a different plan.
Dr. Reeves and I have actually even brainstormed some retired people's names that might be interested in helping with contact tracing if we need to do that. So he's looking for ways to help and support our nurses. So I'm glad to see it. Dr. Danley, I think we're back to you to get to talk about kindergarten.
Okay, great. I love talking about kindergarten.
And Beginner's Day.
So usually, as you know, historically, Beginner's Day has been a nightly event, large crowds, lots of people, and we can't do that this year. So I do have to give a special thanks to our elementary principals, our assistant principals, our pre-K teachers, our kindergarten teachers, Lynn Holmes, Elia Spencer, and Amber Flippin. We came together to do some brainstorming to make sure that our earliest and our newest students still were able to receive what I call a special welcome into Surry County Schools, but it is going to look different this year. We will do a Welcome to School Beginners Day at the same time as we do their kindergarten readiness screening. So we're asking them to come to our schools by appointments, and they come one time. In the past, they would come to the big night event and then come at a later date for their scheduled appointment. We will focus first on our kindergartners who will start, and then for pre-K, we will do a separate date for our 4-year-olds. Just really trying to spread it out, have everything scheduled. We have ordered materials to make sure, additional supplies, that we have everything for our safety protocols in place. And I actually spoke with a couple of parents this week on the phone, and they were grateful that their students were still going to get to come, and grateful for the opportunity to be able to schedule an appointment.
I'm thankful our principals, it's an extra step, something else for them to do as far as the appointments, but it's, so far I've heard it's working fairly well. Our parents are still registering online and still calling the schools to get signed up for kindergarten. So I feel good about this. So far, we've opened up registration, and it seems to be working well. So wanted you to know that we have changed what we used to do, and thank the curriculum committee for their support on that change as well.
Deanne, do you see any chance of numbers increasing in the pre-K, or I don't know about on the state level? Is there any in the political realm?
Funding for it, or number of students?
Yeah, more new students. I mean, more opportunities. That's what I'm saying, more opening up spaces.
So
Because I
Dr.
know somewhere last year or two that North Carolina's going to try to open up more pre-K.
So Mr. Coe, I've been talking to Don Martin. He's actually working with some representatives on the expansion of pre-K. I think there's an opportunity. I think one of the issues that we've always had is you got to have the pre-K spaces, and they've got to be certified. Obviously, if we could get more slots, in fact, I had that conversation with Amber. What schools would we identify that could potentially add a second pre-K? So I think we have 2 or 3 that we would feel good about adding a pre-K, where we continually have waiting list. The other question, I think, or the other answer I would give you is this: I'm expecting a larger kindergarten class this year, because I feel like many of our parents, if they had a rising kinder last year, not really knowing plan A, B, C, I think a lot of parents kept them home. And they just said, we'll bring them to kindergarten the following year. So I think you're going to see some 6-year-old kindergartners beginning with this current class. So I believe that is an option that many parents have utilized, and I think we'll see a larger kindergarten class than we have typically seen in the past.
Travis, you know, for pre-K, they'll have the same number of slots that they had last year.
As far as I know, Mr. Goins, but pre-K is always one of those hot topics that's discussed at the legislature during the long session. I certainly would hope we don't lose any slots.
All right, Dr. Danley, North Surry High School accreditation.
Yes, so the State Board of Education at their January meeting approved of the North Surry High School accreditation. Prior to her retirement, Dr. Reinhardt worked closely with Mr. Atkins and Dr. Badgett and the North Surry staff to make sure we had fulfilled those requirements, and so we are very excited to have received the certification of accreditation for North Surry High School.
Congratulations to North Surry, and I appreciate the work that went into it. It's a lengthy process, even under the new guidelines.
Yes, ma'am.
My report is next, and it's the same as it's been every month. Just thank you to everyone who has done all they can to help students and to help us navigate through this. And we are on quite a journey, but we're going to stay on it and do the best we can for kids. So thank you to all of you, and appreciate your leadership, Dr. Reeves.
Thank you, Dr. Mosley. We appreciate the support of the board and the support of the community. I had a Parent Advisory Council meeting last week, and we asked our parents some questions. Lucas and Donna led that through this innovative task force that we've created, and they're leading, just trying to learn from what's happened, how we've been operating, and then where are we going in the future and what changes are making. So I just want to say thanks to Lucas and Donna for leading that, joining me with the Parent Advisory Council, and I want to thank those parents for serving. And I guess at the end of the day, what we found is that yes, we know things aren't perfect, but our parents had a lot of good things to say during that meeting and gave us some good suggestions of things as we continue to look for ways to improve. Board members, Surry County Schools will be celebrating Black History Month and celebrating the accomplishments of African Americans throughout the history of our country. So I appreciate all the effort that goes into Black History Month in our schools with our principals and teachers. Also, I want to give you an update on the third draft of the high school athletic conference alignment. This is a little different than the first draft that we shared with you. And Mr. Vi and Mr. Atkins are keeping close tabs on this. But in this update, we are in Conference 37 in the 2A West Conference. So we have all three high schools in a 2A conference, along with Forbush, North Wilkes, West Wilkes, and Wilkes Central. So that's the Conference 37. Kevin, what is the next step with conference alignment?
February 10th is the deadline for final appeals to the realignment committee. They must receive that, and then February 17th, final appeals, they'll look at those. And then March 2021, the board of directors will hear any final appeals based on procedural errors. And then obviously the new alignment would start August 1, 2021.
So if you remember the first conference we saw, we were in a 1A, 2A split conference. And so now what they did is they took two of those 1A, 2A splits and they put all the 1As in one conference and all the 2As in another conference. So
East Surry is now 2A?
They will be moving up to a 2A, yes, sir.
So it looks like other than Starmount, we've got Surry, Yadkin, and Wilkes all in one conference now.
Hallelujah.
Well,
What took so long?
actually, it's an old 3A conference we used to have years ago.
Yeah.
It's with the exception of East Surry being in it, it's the old 3A conference that we used to have.
So there's another Stokes County schools in the conference, or did I just not hear that?
Just Wilkes.
Just Wilkes.
Wilkes and Forbush.
You know how far west Wilkes is?
It's not too bad. I used to have to go there.
It's a lot better than Caldwell when we traveled in the early 2000s.
It's a lot better than Statesville and High Brighton and West Iredell and South Iredell. So it's an old 3A conference though that we used to have. It's pretty similar.
Dr. Mosley, that concludes my report.
Okay, thank you, Dr. Reeves. At this time, I'll entertain a motion to approve the consent agenda.
Motion.
Motion from Mr. Goins. Do I have a second?
Second.
Second from Mrs. Sutphen. All in favor?
Aye.
Any opposed? Thank you. Mrs. Sutphen, policy.
Your favorite part of the meeting.
We've just
Yes.
been waiting so long.
We have been bated breath. We've been
And
waiting.
actually, I think these are just to be put on the table for you this month because we did meet in the month of January. About 5 of the proposals, if I've counted them right, of the policies do have a little bit of change to them. Some deal with facilities. We are already operating in that process. A couple of them relate back to some policies that we've updated in the last few months on harassment and bullying. I know there's one in there on that. There are a number of them at the end are, I guess, what you would consider a clerical edit with the change of the crowdfunding policy number being updated. We do have one, 8220 is related to that crowdfunding. The copy you have has blanks in it regarding an amount. We've reviewed that within the last 18 months. That blank should be 10,000. We just didn't fill that in our meeting. But it would stay the same except for, again, it's some of that clerical type edits. So we'll put those before you to review for next month, and then the committee is looking again, I think, to meet in February to discuss other additional policies.
We appreciate the work of the policy committee, so we'll acknowledge these policies to be placed on the table for the next till the next board meeting.
Thank you.
Thank you. David Brown, bid on Chromebooks.
I'd like to ask board to approve the bid for Trinity for 700 Chromebooks for the one-to-one program.
Okay, Anybody have any questions for David on that?
Just, David, in reviewing them, it looks to me like the big difference is that Archangel had a lower price but only had a 1-year warranty, and
Correct.
Trinity gave us a 4-year warranty.
Correct, and
Okay.
also they quoted the wrong bag.
Okay.
I asked for the always-on info bag, and they quoted another bag. And if you look at their warranty, it's a mail-in only. We have to mail the device to them. With Trinity 3, they send us the parts, and we repair them ourselves.
And it looks like it was just a pass-through from the manufacturer, right? They really weren't for the Archangel warranty.
Correct.
We got 4 times the warranty in a school setting with Chromebooks with Trinity.
And that's an ADP, that's an accidental damage, so.
Good.
And they'll replace it.
Okay. That's all I have.
And have we ordered from them before?
We've been ordering from them for about 6 years.
Yeah, okay. And is there any?
Pace we are now, they'll go to the 6th grade. If we go back to in-school, Meadowview 6th grade will get new ones, and the rest of the 7th grade at the other schools will get new ones.
Okay, thank you.
You're welcome.
Can you get them, David?
I'm sorry?
Can you get them? I understand they're big.
It's about
late.
they say it's about a 4 to 8 week lead time.
That's not bad.
Any other questions for David Brown? I entertain a motion to approve the bid for Chromebooks from Trinity.
Motion.
Motion from Mr. Badgett. Do I have a second?
Second.
Second from Mr. Coe. All in favor?
Aye.
Any opposed? Thank you, David.
Thank you all very much.
Thank you.
Thanks, David.
Thanks for the headache.
Dr. Danley, I think we got you again.
Yes. So I come tonight for your approval on our Surry County Schools Personalized Learning Team. We did receive a digital teaching learning grant from DPI, and a part of that grant is the establishment of this team. Teachers did apply, and we used a criteria rubric for that selection. You have the list of the teachers' names, and ask for your approval. They do receive a stipend for their work, their participation, and they will be creating Canvas learning management system courses. They'll be exemplar. We'll give feedback for those, and then also I will work with them to get some technology, Chromebooks, IPVOs, or document cameras, or some type of software subscription as they comply with the requirements of being on this team. So I ask for your approval. Again, the curriculum committee, I worked with them on this as well.
Any questions for Dr. Danley?
So I'm sorry.
How long will they serve?
So the grant I have to have everything spent by June 30th. So we'll do February through June. We'll work.
Oh, it's a quick turnaround
It is quick.
team.
Yep.
Okay.
It is.
Okay.
And it looks like the representation is across disciplines, it's across grade levels, so we'll get a little bit of input from everybody. Good.
That's what we're trying for. That was our aim.
Good.
Okay. Motion to approve.
Motion.
Motion from Mr. Badgett. I believe I heard a second from Mr. Coe. All in favor? Any opposed? Thank you, Dr. Danley. Thank you for your work to secure that grant. That was a quick turnaround too, I know. All right. And you can just keep right on talking.
All right. So, the last thing I come for tonight is your approval on our Surry Online Magnet School application. We learned a lot through the past 7 months, and we felt like that to strengthen our choice program of magnet schools here in Surry County, that there needed to be some alignment in our application process, that we needed similar processes, the applications needed to look similar. So we used what we did with Surry Early College High School and Meadowview Magnet and made some changes to our online magnet school application. It does include a memorandum of understanding. We did want to make sure that parents understood their role as the support and help at home because the school is virtual, and also make sure that we were getting input from any previous schools or teachers. We do the same thing for Meadowview and the early college. And also the school improvement team at SOMS had some input on the application as well. And I value that teacher input to make sure that all of their students are successful.
Any questions we have a motion to approve?
Motion.
Motion from Mrs. Sutton. Do we have a second? Second from Mr. Goins. All in favor?
Aye.
Any opposed? Thank you. We appreciate your work on that. At this time, we need a motion to, you need something?
I have one announcement, Dr. Mosley. Board members, January was board member appreciation. And as an appreciation gift, you see at each table a gift that's been wrapped for you. And I think you'll recognize it, but it's really cool. So we just want to say thank you for your leadership and support, and that's a gift for you, Surry County School Board members.
Thank you. We appreciate it.
Thank you for all the cards and recognition we
Yep.
received.
Thank you. That has really been appreciated, all the different cards and letters.
Yep.
Thank you.
Thank you.
All right, then at this time, I will entertain a motion to return to closed session for the previously mentioned reasons.
Motion.
Motion from Mrs. Sutphen. Do I have a second?
Second.
Second from Mr. Badgett. All in favor? We are now in closed session. Thanks to all of you who have stayed with us all evening. We appreciate you.
Go home and eat supper.
Yeah, go home.